What's going on, everyone? Ali Reza here, back with a brand new episode of Iran Tech, and in this week's episode we're going to be focusing on what is going on in the bleeding edge of the world of oral and maxillofacial surgeries and the role that prosthetics and implants, more specifically 3D printed custom patient-specific prosthetics, are playing in that realm while being assisted by an actual professional oral and maxillofacial surgeon who's also a university professor. So stay tuned as we get started. Let's go over a few scenarios in which a maxillofacial surgery would be necessary. We of course have congenital defects, defects and malformities in the facial bone structure that may happen at birth. Some parts of the skull may just be entirely missing, which would need to be replaced with an implant, because there's very little you can do with the bone outside of replacing it or taking it out entirely and again replacing it with a prosthetic. Then of course we have traumatic injuries that may be caused as a result of an accident, some workplace incidents, or maybe two people just having a fight. A motorbike rider could hit his chin on the ground and break his jaw, and again you can't do very much with that jaw. You can't really repair it. You must essentially replace it with something like a prosthetic, which we're going to get to. Then of course we have certain infections and pathological diseases that could cause erosion in the facial bone structure. We even saw some cases in the post-COVID era, or rather post-patients getting COVID era, where certain infections, certain types of fungi would grow in this area and would cause erosion in the facial bone structure. We have cancer tumors, which are a primary suspect for maxillofacial surgeries. Cancer tumors can completely erode a certain parts of the skull by the cancer tumors growing and replacing those healthy cells. And again, you have to just take out those and the entirety of that cancer tumor and replace it with something. So this is where custom-made 3D printed prosthetics come into play, because we have traditionally been treating these conditions by using off-the-shelf parts most of the time. This is not a new surgical procedure. It's just that now that the modern thing about it is the replacement of off-the-shelf parts with custom printed patient-specific parts that can even replicate the contour of the jaw without too much grinding to make the off-the-shelf part fit the facial structure, the bone structure of the specific patient. So now let's listen to Dr. Bayat, who's a surgeon performing maxillofacial surgeries on a daily basis. Tell us more about these conditions, and also where Iran is with regards to the bleeding edge of what is going on in the science of maxillofacial surgeries.
We
require the fabrication of a custom prosthesis for the patient, which necessitates specific software, filters, and resources, all of which are now available within Iran's domestic capabilities. This includes a specialized software for virtual design and reconstruction, as well as a trained workforce proficient in using these tools developed through local university research centers. The process relies on advanced 3D printing technology, with printers manufactured domestically. For practical models, FDM or resin-based printers are used, while the final medical-grade implants are produced through laser sintering of titanium powder, a technique that ensures biocompatibility. Each prosthesis undergoes rigorous post-processing involving physical and chemical treatments before it is approved for surgery. Furthermore, Iran has developed the capacity to produce patient-specific implants through local knowledge-based companies. The quality of these domestically produced implants matches or exceeds international standards in certain aspects. We are committed to expanding these capabilities and continue to integrate digital surgical guides and 3D printing technologies into standard implant procedures, consistently delivering advanced medical solutions to patients.
And now let's take a closer look at one of these actual implants. There's not too many of them available here because each one of them that is built for a specific procedure, and they're used and they're probably in the patient's face right now, but there are a couple available. So they're made of titanium. They're all custom 3D printed to be patient specific, and they're used in a variety of different oral and maxillofacial surgical procedures. So this one is a mandibular implant. Let's take a look at a couple of the other examples that are used. Let's take a look at a specific model that is used for an orthodontic procedure, which involves cutting the jaw and realigning it for your teeth to align perfectly fine. So this one, you can see that there's a cutting guide for the surgeon, and you may assume that you can just cut anywhere around the jaw to be able to realign it, but no. The cut has to be optimal so as to minimize the potential damage to the patient. Maybe there's a root canal underneath this cut that needs to be avoided. So there is an optimal cut, and using this guide, the surgeon can optimally cut the jaw to be able to realign it. Now, of course, for the realignment itself, there are a couple of other guides which will be used to measure where exactly the jaw needs to be, because these two pieces, which are going to be mounted onto the teeth, how these two pieces are going to align together. This will tell the surgeon where exactly he needs to fit and fix the new jaw alignments. And that fixing is going to be done using these custom plates. There's going to be screws to hold the new place where the jaw is in place. There's, of course, other types of implants that are used with the same procedure. We have the superior stall implants, which are used for patients that cannot take teeth implants like a normal patient. So maybe the bone structure is too weak and cannot hold a tooth. So for them, these superior stall implants are going to provide a placeholder for the tooth implants, and that's where the oral 3D scan, which we're going to be seeing in just a little bit, comes into play. So taking a look at the manufacturing process, there's a couple of prerequisites that need to be checked before we start manufacturing this custom implant, and that is the combination of the 3D imaging capabilities of a CAT scan with this oral 3D scanner. This is not emitting any kind of X-rays or anything like that. It's just like a regular camera that is right here, and it's using a mirror to be able to image the inside of the mouth, and particularly the alignment of the tooth and the gums, because once these implants are made, there are certain holes that need to be put in the implants to very accurately tell the surgeon where the implant tooth is going to be added, because those holes are where the implant teeth are going to be filled in with. So with that said, now that you've seen this imaging system, of course you're going to see some CAT scans too. Now let's take a closer look at the manufacturing process after the imaging system has been gone through.
Titanium implants have proven so far to be the best type of implant when an implant is necessary in facial reconstruction or cosmetic surgeries. This is due to their strength, biocompatibility, and ability to integrate with bone, or osseointegration. However, like any medical procedure, there can be potential complications or issues associated with titanium implants in the face, but they're not 100% free of risks or complications. The biggest inconvenience is that metal is more sensitive to temperature changes, particularly in cold weather, when you may feel that the implant has gotten way colder than the rest of your body temperature, and you would feel it. Over long periods, the implant may also move a bit and cause asymmetry, as rare as it may be, or put a bit too much pressure on the bones around it, can cause deformation. As rare as both these cases may be, there must be a better way to go about these procedures. What if there was a material that could gradually degrade over time and be replaced by your actual bones? That means it can be metal, with all desirable and not so desirable properties that it brings. This is where we delve into the uncharted territory of bioimplants.
در یکی از کیسایی که ما از این تکنولوژی‌ها استفاده کردیم
In one of the cases where we used these technologies, the patient had a benign mandibular tumor that needed to be removed. First, we performed the surgery virtually in a virtual space and created the surgical guide. We built the guide for the specific location where the pathological bone needed to be cut. We went into the operating room, installed the guide on the patient's jaw, and made the cut exactly where the bone was to be removed. After this stage, we fixed a custom-made patient-specific plate onto the remaining part of the jaw. Because it had been completely pre-designed, even the holes used for the guide matched the holes for the screws on a final prosthetic plate. It fits into place with 100% accuracy, causing no cosmetic damage to the patient, and the contour and shape of the patient's face and jaw are completely preserved. Following this stage and the installation of the plate, using the scans we had previously taken of the patient's teeth, we 3D printed teeth that were identical to the patient's own and delivered them to the patient in the same session, right in the operating room. This means the patient enters the operating room with a tumor, undergoes surgery and reconstruction, including dental reconstruction. The patient comes in with their teeth and leaves the operating room fully reconstructed with both bone and teeth restored. This is truly one of the most advanced procedures that can be performed using these technologies.
The implants that were explained, the titanium implants that are now being manufactured as customized and PSI, patient-specific implants, are the latest products currently being used in global markets for patients and have resolved many issues. However, the technology of implants, in terms of materials, is related to second-generation biomaterials, and now third- and fourth-generation materials are also entering the market. These are materials that are biodegradable, and, after a certain period, the body decomposes them, allowing natural tissue to replace the materials. The fourth generation even involves the use of living cells or tissues to create materials. Technically, and in terms of using 3D bioprinting technology, we have achieved self-sufficiency in our country, thanks to God, and we are benefiting from the services provided by domestic knowledge-based companies.
The titanium implant that I showed you are considered second-generation implants, the first one being off-the-shelf parts that I mentioned. The third generation is the biodegradable implants that we just talked about. And fourth generation, which is by no means widely used yet, are biomimetic implants. They're still in the research phase, but they essentially involve the same biodegradable implant that we showed you with biomolecules, proteins, or drugs or other cells that a medical professional may deem to be helpful or necessary for the integration of the implant within the facial structure to be added within the perforation to create a biomimetic implant. Now, these biomimetic implants could help, like I said, a better, faster integration of the implants within the facial structure, but they are by no means yet financially or rather commercially available yet. So if that actually starts to develop within this facility, we're definitely going to be coming back to check it out. And with that said, we've come to the end of this episode of Iran Tech. Thank you guys for watching. I'll see you next week.